introduce to you Dr. Gruenn MD, who is going to be talking about mercury detoxification along with other things, and Dr. David Kennedy DDS, who will talk to you about mercury poisoning from silver fillings, and no doubt he will slip a little bit of information about fluoride in the side door for you. Our panel has now arrived, and his name is Professor Shakman, and he has done an enormous amount of research on root canals and jawbone infections. So we could start our panel with Dr. Kennedy.
Let me lead off by introducing myself. I'm Dr. David Kennedy. I'm the past president of the International Academy of Oral Medicine and Toxicology. I have a degree in biochemistry as well as in dentistry. But about 16 years ago, the Academy was formed by dentists, physicians, toxicologists who wanted to begin to practice evidence-based dentistry. Now that may sound strange because you thought the dentists had evidence for what they're doing, but they don't. It's anecdotal. Is it my father did it that way, my grandfather did it that way, and so why don't we do it traditional? So dentists are talking about traditional dentistry versus evidence-based dentistry. And so the Academy has brought science into dentistry for the first time in over 150 years. And one of our first experiments was we measured the amount of mercury in the people's breath. And what we found were enormous levels. Today in Los Angeles, if the air outside got above 0.3 parts per million, that you'd be in a type 4 smog alert with don't breathe the air. And that's because a baby was poisoned almost to death at 2 parts per million from paint that was on the walls of the new nursery. So the EPA prohibited any mercury-containing paints and reduced the permissible air quality down to 0.3. What year? 1992. And when in 1984 and 5, we were measuring the intraoral mercury vapor of people with a dozen fillings, which is the average number of fillings in Canada where we did the experiments. Murray Jimmy found 32 parts per million in the average person's breath after breathing. And it didn't go away when they quit chewing, after chewing. It didn't go away when they quit chewing. It took 90 minutes to drop back down to about 5 parts per million. And that's just inside the oral cavity. There are criticisms of that research. Oh, people don't chew very often. They breathe out through their mouth when they chew. These are ridiculous criticisms. When you do autopsies, and I call it the LA County Roadkill Study, Dr. David Eggleston published, showing that the amount of mercury in your brain, which is the critical organ, is proportional to the number of fillings in your teeth. That nails it, folks, right there. The predominant source of exposure of your body is what you've got in your teeth for mercury. Who agrees? World Health Organization. Now, there are over 9 countries worldwide that have prohibited the use of mercury fillings in what are called vulnerable subsets of the population. As one of my friends, I've spoken in Germany twice. They banned it in 92, and then everybody that did that got fired, and so we're going to reinstitute the use of mercury fillings. And they said, don't you think we should hear from the experts that talked in 92? And so we had a quick trip back to Germany, 12 for and 12 against, and it was a moderated, peer-reviewed meeting in Offenhausen, Germany. And what they did is they prohibited it in even larger numbers of the population because we blew their socks off. All they could say was, your breath isn't as bad as the hazardous waste dump. You could work there, but as Lars Freiberg from the Karolinska Institute said, one of our moderators, he said, even if we use the hazardous waste dump standard, which we cannot, because children are more vulnerable, we don't know why, but even if we use that standard, it's only for an 8-hour day. You're around your fillings 24 hours a day, and clearly some people exceed that standard. We cannot base our discussion on average. We have to base our discussion on the extremes. Speaking of extremes, I've measured over 300 parts per million in the breath of a dentist. In California, if the level gets above 100 parts per million, that you have to immediately evacuate the hazardous waste dump and put on a spacesuit with tanks. I've measured patients over 100 parts per million. As a matter of fact, if you have a mercury filling, the air inside your mouth was well over 100 parts per million the last time you had a mercury filling put in your mouth. And these are OSHA standards, not EPA standards. So I've said over and over again, we do not need laws against dental amalgam. The only way the amalgam can get from the manufacturer into your mouth is for the dentist to repeatedly violate the laws of this state that we already have. And one of the laws is Prop 65. You know, when you go to the filling station, there's a placard on the gas pump that says, you know, pumping gas can cause cancer and birth defects, and inhale at your own risk. And I always pump my own gas, but I stand upwind and get as far away from that tank as I can, because that's true. There's lots of stuff in gasoline that's not good for you. Prop 65 just gives you a warning. And I like to have warnings. It's good to know. Well, the dentists are required by law. They fought it all the way to the Supreme Court, and they lost all the way to the Supreme Court. They're required by law to tell you that they use mercury fillings, which are known to the state of California to cause birth defects. If a dentist does not have that placard up, he'll be subject to a fine. Prop 65 does not have enforcement, except to citizens. So if you wanted to get in your car with a phone book and a list of all the dentists in Los Angeles, there's about 5,000 of them, and you went into all their offices with your little video camera and said, "Can I see your Prop 65 sticker for Mercury?" And they don't have one. So, well, thank you. You'll be hearing from the EPA. And then you notify the Cal EPA that you'd like to file a citizen's complaint, and you will share 50-50 with the fines that are levied. Do you think you could make a Prop 65 sticker appear in every dental office in Los Angeles in about a week? It's just like the Highway Patrol. They don't enforce every single car to go 65. They periodically grab one, pull them over the side of the road, and spend a half hour slowly writing a ticket, while all the rest of us go by and say, "Ooh, looks like we better go 65," because it's a violation of the law. You have to enforce laws in order to get compliance. And so Prop 65 right now is being violated. So when some citizen takes it upon themselves to enforce that law, they will, one, be fairly well rewarded, because if you figure, you know, what's a homeless guy get? Standing out there collecting pennies and nickels and dimes all day long, maybe $100 a week? You know, fines are going to be $100 to $1,000, and they're going to get half of that. Turn the homeless loose on it. They'll get it straightened out. No more aluminum cans for them. Just go in and get the dentist with their Prop 65 missing. So that's mercury fillings. And actually, you can't get the material mixed. Before the Food and Drug Administration, a colleague of mine, Dr. Wayne King, went into the panel discussion, staffed primarily by dentists, and demonstrated that when you mix dental amalgam and open the capsule, that it's over 1,000 parts per million, 10 times higher than you can legally have in a hazardous waste dump, much less your house or your home or your own mouth. It's 1,000 parts per million right in the area of the capsule. Mercury fillings, the issues are simply a question of, are you willing to replace your mercury filling with another mercury filling? The International Academy of Oral Medicine and Toxicology has not recommended the removal of dental amalgam, because if the same careless attitude is used in the removal of the amalgam, you unquestionably will be exposed to enormous levels of mercury, which cannot be considered safe by any standard. There is no safe threshold for mercury exposure. So we don't recommend that you get it removed carelessly. Posted on the internet and in a copy of my book, which Fran has at her booth, How to Save Your Teeth, there is a protocol for the removal that has been demonstrated in the scientific literature to not make your blood level of mercury go up. It drops precipitously over the next 7 months, and so your level of mercury in your blood drops about 90% in 7 months when all your mercury fillings are removed. That kind of tells you what was in your blood, doesn't it? They did it following the normal protocol in the first experiment in 1990. The blood level of mercury shot through the ceiling. They didn't even sample it soon enough to get it on its way up. It had already started down by the time they took the first sample, but it was enormous. It took it almost 60 days to get back down to the point where it was the day they started. And a year later, it had only dropped 50%. But we know, if you take them out carefully, it drops 90% in 7 months. A year later, these people still had only dropped 50%. That means some of that spike was still coming out after a year. That kind of exposure is unconscionable. And the reason the dentists are doing that is because we have dental schools in the United States that do not instruct the students in how to handle hazardous waste material. I went to UCLA. I sniffed around their clinic with a $5,000 mercury sniffer. I found high levels of mercury in student areas. I contacted the dean, explained to them that there were high levels of mercury contamination in the UCLA dental clinic. He said I had illegally measured his clinic. I said, Dean Sherrick, I was attending a class at the university, so I am a student. And as a student, I am protected by not OSHA, but EPA. So you illegally exposed me to high levels of mercury. He says, we keep all of our clinics within OSHA standards. And I said, Dean Sherrick, patients are not employed by the university. OSHA is only for employees. The EPA protects civilians. Cal EPA is very specific. Mercury is not safe at any level. Dentists don't have to wear pagers. I have a gingival infarct. So, we don't recommend the careless removal of dental amalgam. We do recommend that you consider alternative materials that are deemed biologically compatible when you replace your amalgams. All amalgam fails. In the experiments to date, 2.5 years is the average life expectancy the United States Navy found when they put in a bunch of fillings and they took them out and inspected the results to see if there was any leakage. In 2.5 years, 50% of the fillings demonstrated leakage. Now, it's going to be another decade or so before it leaks enough for a piece of the tooth to rot away so the naked eye can see it without taking the filling out. So any filling that's over 10 or 15 years old probably has substantial leakage around the margins. And when I speak of leakage, I'm not talking about mercury. I'm talking about decay, water percolating, saliva percolating around the edges. All mercury fillings leak mercury continuously throughout the life of the filling. There has never been a mercury filling that did not leak mercury. Even mercury buried underneath crowns was demonstrated as early as 1928 to leak mercury. And crowns in the mouth also suck mercury out of the filling. Who says? The manufacturer says, do not put mercury fillings in contact with other metals. No real specific. And don't implant it at the apex of a tooth for a retrograde amalgam filling on a root canal. And that's still taught in the dental schools of America today. So basically, we have dental schools teaching dentists to do stuff that the manufacturer of the material says not to do. That's amazing. So when you go confront your dentist with this information, they'll fly into a rage. One of the things about mercury poisoning is it causes irrational anger. So you wonder why dental assistants often complain about the dentist going off the deep end and throwing instruments at them. Is that A, normal behavior, B, bozo behavior? And that we have a lot of dentists who have been accused of behaving in a somewhat abnormal fashion. And in the scientific literature, it's been demonstrated that dentists are, in fact, neurologically impaired. And the amount of mercury in them is proportional to the number of days a week they work, the number of amalgams they put in, the number of amalgams in their own teeth, and the manner in which they practice and the contamination of their offices. In the not very recent, it was about 15 years ago, study of California dental offices, something like 15% of the offices were above the California threshold for occupational exposure, above 50 parts per million continuously throughout the day. One of my colleagues in San Diego had a horrible stroke, devastated him, he passed away. His son was a physician going to practice in his dad's old office. Wanted me to check the office and see if it was safe. His waiting room was 400 parts per million. His favorite operatory was 100 parts per million. Mercury has been shown to be a contaminant and a cerebral vascular damaging chemical for almost 150 years. The first atherosclerosis that was ever diagnosed in a medical community were the German mirror workers who would use mercury silver, like you have in your teeth, only mixed into a liquid, poured over a piece of glass, and then heated. It left the silver on the mirror. So that's how they plated silver. Although physicians have been cutting up human beings for 2,000 years, the first time they saw atherosclerotic plaque in the arteries was in the mirror workers who were exposed to mercury vapor. Most recently, there was a study from Italy on a new disease. It's called idiopathic cardiomyopathy. Anybody heard of that one? It's where, especially in young people, 30s, 40s, the heart develops, becomes flaccid and gets bigger and bigger, and then it just quits beating altogether, and you either get a heart transplant or die. But in the chemical analysis of the degenerative heart disease, they found that there was 22,000 times more mercury in that heart than the control, which was killed in a car wreck or died of unnatural causes at the same age. And there was also antimony in the heart as well. Jane, your turn.
Can we round it up now, Dr. Green?
I think I got it. Let's see.
Is there anything else you'd like to add?
Let's see. Well, in 1985, the International Academy of Oral Medicine and Toxicology called for a ban on the further placement of new mercury silver fillings until such time as the alleged evidence of safety is produced by the manufacturers and the dental trade associations. Since mercury can damage a fetus while the mother's health is apparently unaffected, we do not recommend removal of a mercury filling or placement of a new one during pregnancy or nursing. I think that kind of summarizes our position.
Thank you very much, David Kennedy, Dr. David Kennedy. I think we'll continue along in the dental vein for a moment. Would that be a good idea, do you think?
What? Sure, fine.
Yeah? And then we'll go to Hans.
Sure.
Very good.
I just told Hans, dentists make him sick, and he's got to make him well.
So I'd like to introduce Professor Hal Shakman, researcher and author, and he will be discussing the dangers of root canals and touching on jawbone infection.
Yes, my name is Shakman. I'm a former government employee. I worked for the Foreign Aid Program for a few years, analyzing health programs. And so, and my job there was basically to decide what makes sense. And so I've got into this whole thing here just as more of an intellectual exercise. I've been a consulting professor for the Capital University of Integrative Medicine in Washington, D.C., and for the American Academy of Biological Dentistry in Carmel. So that's my meager credentials. One thing that Dr. Kennedy mentioned, and this is along the line suggested by my research, is that since the removal of, and I don't know if IAOMT is even could possibly even consider this, but since the removal of mercury is such a problem from teeth in place, one way perhaps that might merit some consideration is just to take the tooth out. That's going to be the safest way to remove it, I would think. And there are some other arguments that would suggest that might be a way to go as well, because from a physiological standpoint, the question needs to be raised as to how different is the tooth from another bone, so that once you have something artificial implanted in it, especially when you have it's a bone that is exposed to the surface, so you're opening the inside of the body to the outside, regardless of what the substance is. And I think we all agree that the worst thing you want to put in contact with your body is a poison like mercury. This was known for quite a while. The father of dentistry, in the early 1700s, Pierre Fouchard, said the worst enemy of the teeth is mercury. This is 100 years before anybody was implanting mercury in teeth. So mercury's got to go, and however, the best and quickest way to get it out and the safest way to get it out is the best idea. And this affects all of us. I mean, if anybody has had a filling done, unless if you've only seen one of the holistic dentists in the last few years, everybody's got mercury in their mouth. So this is really important to keep in mind. The question then, the two things that Ms. Lee asked me to talk about were the root canals and about jawbone cavitations. A root canal, I think you have to start looking at the tooth as it's a bone. It's basically a bone. The physiological tests say that it's a bone, and the Dr. Boyd Haley, who was on the bill with me over in Carmel a few months back, has acknowledges that histologically, is the term that they use, that the tooth is a bone. It's basically a bone, but it's one that's exposed to the outside, so it's got kind of a skin on it, which is a lot like the substance in your fingernail. Fingernail and enamel are basically the same thing. Okay, when you get past that, past the fingernail or past the enamel, you're basically into bone. And when you get down into the root canal is the bone marrow. So if your tooth is hurting and the dentist says that you need a root canal, what he's saying is we're going to take the nerve out of your bone. We'll take the bone marrow out of your bone. Now you've got a dead bone. And I was at a meeting just last night that Dr. Kennedy mentioned that the difference between a dead toe bone and a dead tooth is that you keep the tooth. Otherwise, it just doesn't make any more sense to keep a dead tooth in your mouth than it does to keep a dead toe bone or some other part of your body. It's not physiologically sound. And if Dr. Gruenn can add anything to that from the medical perspective, we would that might serve some amplification. So we have a jurisdiction here between the doctors and the dentist that the dentist can't go past the mouth, and the doctors are constrained from going too far into it because of the dentist's purview. So somehow we have to bridge these gaps, and this is why a meeting such as this today and continuing meetings between people that are looking into these two areas they're very important. So much for root canals. I mean, it's like you need a root canal like you need a hole in the head. A root canal is a hole in the head. It's always going to be infected. The studies that I've done is there's no way that you can have something where you have a bone sticking out of your body, where you've taken out the bone marrow, and it's exposed to the atmosphere. There's no way it cannot be infected. Now, I know that there are some very good scientists now that are using some tests. Dr. Boyd Haley at Kentucky is in particular is using a type of test for toxicity in teeth. And I've suggested to him and also to Dr. Jerry Bucco that they try some of the methods that I've been studying, Dr. Rosenau's. My main field of study in this area has been, I've studied the work of Dr. Edward Rosenau, who was with the head of experimental bacteriology for the Mayo Foundation for 30 years. He's an incredible scientist, and basically using Rosenau's techniques, which are not all, they're a little difficult, but it's very easy to understand. He just basically used a culture technique that replicated the conditions in the human body, where you don't have zero oxygen and you don't have full oxygen. There's something in the middle. So he used these deep tubes of dextrose brain broth so he could get something in the middle, and then he was able to find the bacteria that grows here that causes all kinds of different diseases. So if we use the proper culture methodology, we're going to find that virtually all root canal teeth are infected. So I think this is very important to keep in mind. So you just don't want, once you devitalize a tooth, you definitely want it out of your body. It doesn't mean that a tooth that is vital should stay, because we have to also distinguish between a tooth that's been infected and a tooth that's dead. A tooth can be alive, a tooth that's and still infected. So if a tooth that's infected it's a live tissue. So the line has to be, if you've got something that's infected, whether it's a tooth bone or it's an infection someplace else in your body, you want to get rid of that infection. So it's now these infections in the teeth. They're open to the circulation. So this is why you have to visualize the whole jaw complex as one complex, so that when you have an infected tooth, it's not sealed off from the rest of your body. There are tubules, dentinal tubules that go all the way through the tooth, and when you get into those tubules, you are open to your general circulation. So at some point, and it's been described as the infection of the root is a long, drawn-out process. It happens from the time your tooth becomes infected past the enamel. It's a gradual process, but then the infection goes through the tooth into the jawbone. So the longer that you keep an infected tooth in your mouth, your jawbone becomes infected. And what's happened now is, and it's not only so that's as far as like infected teeth or teeth that have had root canals and so on. It's also the case for wisdom teeth. When you've had a wisdom tooth extracted, there is a membrane between the tooth and the jawbone. If that membrane isn't cleaned out properly, then it gets sealed in, and then that continues the infection, and it starts to eat away your jawbone. And these are very common. I hear the dentist talking about third molars. The third molar site was infected. The third molar site was infected. What they're saying is that basically most people that have had wisdom teeth withdrawn, the practitioners were not that aware of the need to really clean out this area, and their jawbones are still infected. So we get all these people that have had their teeth pulled, and they say, well, I have these diseases. The doctors are saying that these are connected to the teeth, but I've had my teeth pulled. Well, the jawbone was by that time already infected, and unless if you really clean it out, you've got that continuing problem. So, and the basic problem is it just doesn't just affect how you eat and how you look. These infections affect your whole body. All of these mysterious diseases, according to the people that I've studied, and they're very authoritative people, all these mysterious diseases are coming off of the teeth. There is no such thing as autoimmune disease. All of these diseases that we call autoimmune disease are caused by an organism that emanates from diseased teeth and tonsils. And this was basically proved by Rosenau, by Billings, by Charles Mayo, by all the great scientists that worked with him, Russell Hayden, Weston Price on the dental side. And in specifically the work of Rosenau and his associates, they fulfilled Koch's postulates. They took an organism out from the oral area, injected into laboratory animals. The people that had, that when it came from people with stomach ulcers, the laboratory animals got stomach ulcers. It came from people with appendicitis, the laboratory animals got appendicitis. So the problem is that if you accept Rosenau's work, you really need to take a real drastic look at dentistry and the question of how far you can carve into teeth, how much you can carve into them at all, whether there's anything that's safe. And this, we are hopeful that the International Organization of Oral Toxicology will start to take a bigger look at this. My fear is that there are too many vested interests in some of these organizations in alternative types of fillings. If you've got a financial, or if you have a financial interest in some type of a filling, and I'll just there are some trade names and different types of things. If you have financial interest in something and you say that that's helpful, then you cannot be totally objective as to whether anything can go in there. So I think we have to examine all these things. There's something called biocalyx, and then there's these composite fillings, and they all have to be examined from the perspective of what's happening to this organism that all of these investigators, Rosenau and 31 other investigators, they published their results in the Centennial Celebration for Dentists, 1940. And Rosenau summarized 11,000 animal experiments by 32 people altogether. So if you use these procedures, it seems like they get the organism. So we need to have these types of techniques replicated today side by side against some of these other studies and see if any of these things are safe. And if not, then we have to take a drastic view, a question about whether we just have to take a whole other look at dentistry. And one way or another, dentistry has to become much more fully integrated with medicine. The dental, we're in a really strange situation because the only people that really kind of have the tools to really dig in there are the dentists. And yet they don't have the mandate to do that. The mandate to do the healing is on the doctor's side. So it's in a large sense what Dr. Kennedy said is right. The dentists are contributing to the diseases, and the doctors are scurrying to try to fix them up. And I want to compliment Miss Lee and Drs. Gruenn and Dr. Kennedy, because these people are they're professionals. They have a lot at stake in this. They're very actively involved in getting the word out, and I feel very privileged to have been invited to join them today. Thanks.
Thank you very much. It's fantastic. And I think that what Professor Shakman is saying